Now at 7, will they or won't they? The mayor clarifies his stance on whether New Yorkers should shelter in place, what he said just a short time ago.
Plus, a curfew is coming to Newark, how it's going to work, along with a closer look at policing during this coronavirus pandemic.
Plus, cluster concerns, a town in Connecticut preparing for the worst as the state reports its first death from the virus.
Good evening. I'm Chuck Scarborough.
And I'm Natalie Pasquarello. We have a lot to get to tonight surrounding the coronavirus pandemic here in the tri-state.
Let's begin with a look at the latest numbers. All told, cases now top 3,000 across our area. There are more than 2,900 in New York with 21 deaths. 427 in New Jersey, where 5 people have died, and 96 in Connecticut, which just announced its first death. And a reminder, these numbers are going to continue to rise as more people get tested.
And while those numbers go up, Wall Street continues to dive. The Dow closed 1,300 points down today. The S&P 500 dropped 5% as investors worry about the economic impact from the virus.
And they're trying to stem the tide on Capitol Hill. The Senate passing a bill this afternoon to expand paid leave and unemployment insurance. The House already approved that plan and now goes to the president's desk. And Congress is already working on a separate measure. This one, a massive stimulus package that could include checks for virtually every taxpayer.
We start tonight with Ray Vieta live in Greenwich Village with what the mayor said about sheltering in place just a little bit ago. Ray.
Natalie and Chuck, the mayor said it would work similarly to what's in place in San Francisco. Grocery stores, parks, and public transportation would still be open. But the governor within the last hour pushed back, saying he's not in favor of quarantining the city. In the meantime, here at NYU, dorms are emptying out. That's because students have been told there's a possibility these dorms could be used as hospitals. Rolling out, packing up, moving out of the NYU dorms. Spring semester here cut short because of COVID-19. NYU preparing for the possibility of dorms being turned into hospitals to deal with the growing number of sick patients.
I'm a freshman. I don't really get to experience like the nice spring that we have here in New York.
And the situation in the city only expected to get more dire. This afternoon, Mayor Bill de Blasio pushing the possibility of a shelter-in-place order. The mayor says it would work like the one in place in San Francisco. Parks would be okay for social distance. Public transportation would stay open. Laundromats as well. Also allowed grocery stores, pharmacies, gas stations, and convenience stores. The mayor clarifying his stance moments ago.
I think some people, and I want to take responsibility that there may have been more than one interpretation out there. When I said shelter in place, I want to be explicit that I'm talking about the San Francisco model because it actually exists right now in this country, and from what I'm seeing, it is working.
I am not in favor of quarantining the city. I'm not in favor of imprisoning people. But obviously, everybody wants the same thing, reduce the density, because density is where this virus communicates.
Today, the governor ordered all non-essential businesses to slash half their workforce. Concerned about an exponential rise in cases and shortage of ventilators, the governor pushed for military intervention. The USS Comfort Naval Hospital is bound for New York Harbor. On board, 1,000 beds.
It's literally a floating hospital, which will add capacity.
Now, as students clear out, folks stock up, preparing for uncertainty and for the surge of coronavirus cases. What's your plan after packing up?
Setting everything back up in my room back home.
And the governor just signed into law something that would benefit those who have to stay home, who are under quarantine, paid sick leave. That just happened within the last hour. Again, at this point, there's still no decision about that shelter-in-place order. We're live in Greenwich Village. I'm Ray Vieta, News 4 New York.
Okay, Ray, thank you. And now to New Jersey. Newark's mayor is putting a curfew in place to try to keep people safe in that state's largest city. And that's just one of the new items now on the place of police officers around the state.
News 4's Brian Thompson joins us from Newark with that part of the story.
Newark's curfew mandatory from 8 at night till 5 in the morning, keeping people off the streets unless there is an emergency. That's defined as going to or from work or some other emergency that you may need to go to the hospital or to the pharmacy or to the supermarket if they're open or to a gas station. Other than that, no excuses. This comes as one person has died now in this city from the virus, a man in his 40s with underlying health conditions, and as a total of 13 confirmed cases have been diagnosed in Newark. Police under orders everywhere to break up any gatherings of 50 or more. Lakewood police saying they broke up 2 large weddings Tuesday night. Governor Murphy today.
We don't want events to go underground into people's homes. If people are gathering in large numbers, we don't care where they're gathering. It's a public health concern. And we will enforce this aggressively.
What's not being enforced aggressively anymore are traffic stops in South Brunswick and elsewhere across the tri-state. Cops worried about exposure and bringing it back to headquarters. That's why doors are propped open when they should be closed by fire regulations. Nor are officers such as Scott Buca going into homes as first responders. If dispatchers determine there are flu-like symptoms, only EMTs are going in. Would you go in?
No.
You would not go in, but normally you would have, right?
Correct.
Does that feel a little odd to you?
Yeah, you have to just adjust with the times.
Many officers have families to worry about as well and are under orders by their spouses to self-sanitize before going in the house. As Buca well knows. Has she been pretty insistent?
Oh, absolutely. Yeah, she definitely doesn't want me to bring anything home.
South Brunswick police say traffic stops have dropped by 97% over the last couple of weeks. And in fact, 3 of their police officers are in quarantine because they were exposed to somebody with the virus. In Fanwood, a police officer, according to the mayor, has come down with the virus. That is the threat that police officers are worried about. That is a threat everybody is worried about, and why Newark now has this mandatory 8 to 5 in the morning curfew. In Newark, Brian Thompson, News 4 New York.
All right, Brian, thank you. The president today invoked special powers to help combat the virus, specifically the Defense Production Act, normally reserved for wartime. It gives the administration the power to force American businesses to produce critical materials, in this case, items like masks, ventilators, medical supplies. The president also ordered HUD to suspend foreclosures and evictions until the end of April. Important to note here that affects only homeowners with mortgages insured by Fannie Mae and Freddie Mac. The president also talked about the expansion of testing, including a possible self-swab kit.
And we think it's working out for the self-swab, and if it would test positive, the people would go and they would do what they have to do. But we think that's probably working out.
The White House is closing temporarily all non-essential travel along the northern border with Canada, a joint decision with the Canadian government. President Trump is also weighing action along the U.S.-Mexico border.
Well, back in New York, 23% of those infected with the virus now in the hospital. And Governor Cuomo says the state needs to more than double the amount of beds currently available. Now, the daunting numbers have healthcare workers bracing for a crush of patients. News 4's Ida Siegel continues our team coverage tonight out of Mount Kisco.
In healthcare circles, they're anticipating what's called the surge, the crush of patients that will go through their doors at the height of this pandemic. Here at Northern Westchester Medical Center, they're trying to get creative, looking for solutions because they are determined to take care of every single person that walks through their doors. On any given day of the week, Northern Westchester Medical Center is a lively place. During the coronavirus crisis, it is exceptionally busy, asking more of doctors than ever before.
People have a lot of anxiety, a lot of worried family members that are worried, but everybody is gearing up and coming to work and doing a great job.
But as the number of infected people continues to climb, officials worry statewide there won't be enough of those doctors and nurses to treat everyone. So they're calling on retirees to come back to work.
If their talents were ever put to the best possible use in their life, it's now, because all of their neighbors are going to face this issue.
And then there's the issue of current doctors working around the clock, constantly exposed to COVID-19.
Are you worried about doctors getting sick?
Yes, we've had some doctors get sick, but we have a lot of contingency plans.
Hospital administrators are also paying close attention to capacity. The governor says there are 53,000 hospital beds currently statewide, but at the height of the pandemic, they will need as many as 110,000 hospital beds.
We met yesterday with all the hospital administrators. I spoke to them. I said we have to increase the number of beds you have in your hospital.
In the meantime, doctors are pushing forward, adjusting to life on the front lines.
It's a bit surreal, but this is what we signed up to do when we decided to be in the healthcare field. So some of us run away, but others, like the people in the healthcare field, run towards this.
So many people referring to those doctors as heroes at this point. Among the potential solutions to create more space in hospitals is to cancel elective surgeries, which many hospitals have already done, but also build new hospitals, potentially in vacant old buildings that used to be hospitals once upon a time, renovate them and get them back up and running. Reporting from Mount Kisco, Ida Siegel, News 4, New York.
In Connecticut, a new push to stop the spread is now in effect. All non-essential businesses in the town of Westport just shut down this afternoon. News 4's Mark Santia is there continuing our team coverage.
Westport police on duty, ready to not only keep the town safe, but themselves safe as well. Starting today, if you call, you'll be asked a series of questions to determine if an officer needs to be sent to your home or if it can be handled over the phone. South on 95, the Stanford Town Center and other malls will close tomorrow. Today, hand sanitizers greeted customers and cleaning crews in masks were wiping down escalators.
I mean, that mall has gotten quieter with all the stores closing anyway, but that was just eerie.
Here in Westport, the town now dealing with a cluster of at least 20 residents who tested positive, and officials are taking unprecedented action.
Yeah, they're making us close the shop by 2 o'clock today.
Customers rushed to salons and barbershops before a mandatory shutdown went into effect. A town official personally made the rounds, delivering the news.
We got to close at 2 o'clock today. Executive order from the town until further notice. Sorry.
Didn't expect this. I mean, business is always up and down, but this is a crusher.
Residents are heartbroken. Ronnie is more than a barber. He's part of their community.
I mean, it's a great place, always a fun place to go get your haircut.
For years, Ronnie Provenzano has been a staple in Westport. He says his business will not survive the shutdown. Ronnie's biggest concern now, his wife and their 6 children.
I got to figure out what I'm going to tell her, because I don't want her to see me, you know. I don't know what to say. This is really going to kill us hard to shut it down.
I'm Mark Santia, News 4 New York.
The New York Stock Exchange is closing the trading floor and moving to all electronic trading because of this pandemic. This is the first time it's closed its floors since 2012 when Superstorm Sandy hit the city. As we told you earlier, the Dow fell more than 6% today, dropping more than 1,300 points. And News 4 is with you throughout this pandemic. We have a variety of resources online. You can track the virus, and we also have information about unemployment benefits and food resources. That's at NBCNewYork.com/coronavirus and on the NBC4 New York app.